Hello and good evening to everyone in the Philippines, and a warm hello to everyone wherever you may be, may it be morning, noon, or night. I am Dr. Anne Rodriguez, one of your hosts for tonight. Welcome to another evening of the Wellness Avenue. I know it's been a while since we've seen each other, but here we all are finally. Let me please introduce to you all my co host, a good friend, and my resilience batchmate, Dr. Javs Esturco. He is a medical officer 3 at the Basilan General Hospital and a private practitioner at the Zamboanga Lifestyle Medical Clinic. Welcome to the Wellness Avenue, Doc Javs.
Thank you for that, Doc Ann. I'm so happy to be spending this evening with you, all our viewers, and of course, our special guests. Today's episode is amazing as we will learn how we can take care of our health and the planet the lifestyle medicine way.
Exactly. I'm so excited actually because I've been trying to improve not only my health, but I'm constantly trying to look for ways where my actions also don't at least add to the harm, that maybe my previous actions had when it comes to the environment or to the planet.
Yes, actually, Doc, that
How
is
about
one
you,
of the
Dr.
reasons
Jabs?
why we. That's actually one of the reasons why we practice minimalism at that, so that there is little impact on the environment.
Right. So I'm really excited about this episode today because today's lifestyle medicine discussion is all about how the planetary health affects our personal health and vice versa. So it's so good to see how more and more people are actually changing their lifestyles, not only to be physically healthier, but to be kinder to Mother Earth as well. So I know it can still be quite frustrating because big corporations and big private entities still hold the bigger responsibility of reducing our carbon footprint on a global scale.
Yes, Doc. Again, let me reiterate that I think one of the things that I think I could contribute in the global climate change actually is the how I could influence my children in practicing using as much possible to be less of to be engaged in consumerism, perhaps. So that's why I really advocate minimalism. So please do invite your family and friends for tonight's episode. Don't forget to share away our live streaming tonight. Remember those hashtags, the hashtag the Wellness Avenue, hashtag the PCLM Talk Show series, hashtag live medicine. Also, feel free to comment your questions for our guests. But before we start, let's talk about statistics. Please enjoy the following video.
Water scarcity has become a challenge in many parts of the world. Many of the world's water resources are being drained much faster than they are being replenished. In places like Somalia and other African countries, people are suffering from drought and famine, and the lack of clean water and proper hygiene are causing massive outbreaks of communicable diseases in displaced person camps. Clean, safe drinking water is scarce. Nearly 1 billion people in the developing world don't have access to it. If only people would have access to clean water, this will improve education, hunger, health, and poverty. In developing countries, as much as 80% of illnesses are linked to poor water and sanitation conditions, and nearly 1 out of every 5 deaths under the age of 5 worldwide is due to a water-related disease. But did you know that globally we use 70% of our water sources for agriculture and irrigation, and only 10% on domestic uses? Food, being at the core of human existence, is the issue which requires the most immediate attention in this social movement for restoring and preserving planetary health. Research continues to produce mounting evidence about global warming being human-induced, with livestock contributing a significant share of the global greenhouse gas emissions. Livestock is contributing at least 80% of the agricultural emissions. On the other hand, the World Health Organization in 2015 categorized red meat as carcinogenic to humans. Based on 800 studies, including 700 epidemiological studies, seems that there is a very clear and convincing picture that red meat is bad for planetary health as it negatively affects human well-being, mainly through its association with cancer, and for the planet through its direct impacts on land use, freshwater withdrawal, greenhouse gas emissions, acidification, and eutrophication. Meat is also a major cause for biodiversity loss, increased rates of non-communicable diseases, including obesity and diabetes, as well as phosphorus depletion, putting at risk future plant-based food production. Moving from current diets to food preferences that exclude animal products has big transformative potential to deal with some of the major challenges humanity faces in these day and age. According to studies, such a shift will free up 76% of food's land use, including 19% reduction in arable land, drastically reduce greenhouse gas emissions by 49%, and have many other planetary benefits.
So that video was very moving, and I hope all of you were able to catch it in full. Before we move on, we do have a few words from our sponsors, but please stay and we will be right back.
Our gut is the home of trillions of living microorganisms. In order to live, multiply, and perform their functions, they need to be fed sufficiently, or else they will look for other sources of food within our body, which will eventually make us sick. Fruits and vegetables contain prebiotics, such as fructooligosaccharides, the right food for our gut bacteria. However, proper amount may not be acquired through natural food only. Hence, supplementation is needed too. Feed your gut with Folago.
Okay, welcome back, everyone. Thank you for staying with us. Before we introduce our guests, may we invite the Chair of Education Committee and the Treasurer of the Philippine College of Lifestyle Medicine, Dr. Bishi Fernan, for a few words. Good evening, Dr. Bishi.
Good evening, Dr. and good evening, everyone. So God has given us this planet not to be a good steward of it. But as technological advances has been quite so fast, the advancement in consumerism has made our way of life seem unsustainable. So what man has been doing to the planet has caused like global warming and a rise of various diseases. I myself have been an advocate of conserving and have been supporting the Philippine Reef and Rainforest Conservation Foundation. And I'm really surprised when I heard about planetary medicine. I'm familiar with environmental medicine and I wonder how it is related to planetary medicine. I know you have a lot of questions in mind as to what planetary medicine is about. And I welcome you all to this very timely and relevant topic on the relationship of what is happening to our planet and our health in the future, and how lifestyle can impact the health of the planet as well. So thank you and good evening to everyone.
Thank you, Dr. Bishi, for that wonderful message. And now let's start our health talk. Okay, so for our very special guest tonight, we have Dr. Renzo Ginto. Dr. Renzo obtained his Doctor of Public Health from Harvard University and Doctor of Medicine from the University of the Philippines, Manila. He is an associate professor of the practice of global public health and inaugural director of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines. So shout out to my college. So, he is also Chief Planetary Doctor of PH Lab, a local think and do tank for advancing the health of both people and the planet. An Obama Foundation Asia Pacific leader and Aspen Institute New Voices Fellow, Dr. Renzo is a member of several high-level international groups, including the Lancet Chatham House Commission on Improving Population Health post-COVID-19, Lancet One Health Commission, the Advisory Council of Global Health 50/50, and the editorial advisory board of the Lancet Planetary Health.
Not only that, though, he also served as a consultant for various organizations, including the World Health Organization, the World Bank, USAID, ASEAN, International Organization for Migration, Healthcare Without Harm, and the Philippine Department of Health. In 2020, he was included by the Tatler magazine in its general key list of 400 leaders of tomorrow who are shaping Asia's future. So Dr. Renzo has traveled to and lectured in nearly 50 countries, published more than 100 articles in scientific journals, books, and popular media, and directed and produced short films that communicate the message of planetary healing to the world. Welcome to the Wellness Avenue, Dr. Renzo, and thank you for spending your evening with us.
Thank you very much, Dr. Ann, Dr. Jobs. I love the energy on a Tuesday night. And of course, thanks to the Philippine College of Lifestyle Medicine for this amazing invitation and opportunity.
All right, so we're so happy to have you here with us. So to start off, can you please tell us what we mean when we say planetary health?
Sure. Do I now proceed to my presentation?
Yes, please. Yes.
Okay, great. So, let me just share my slides. So for the next several minutes, I will try to answer that question and share with you some of the main issues, challenges regarding planetary health, and what is the role of lifestyle medicine. So, this is what I'm very excited about. I think every physician, every profession has a role to play. Can you see my slides now? Just want to make sure. Okay, great. Okay. Because I think in Facebook it's not showing up yet. Okay, now I can see it. Great. Okay, so for the next several minutes, as I've said, I'll be talking about what planetary health is. You might have a lot of questions about it. I'm actually very, very thrilled, but also moved by the opening video that you showed a while ago. You captured some of the major challenges that confront not just the health of people, but also the health of the planet as well. So before I proceed, or to start, I just want to inform all of you, there is a very recent article just published in April in the American Journal of Lifestyle Medicine talking about planetary health, climate change, and lifestyle medicine. So I think this article was wrote for you. They already anticipated that you will be having this webinar about planetary health. So now they came up with this reading material. And many of the issues in this article I'll be definitely covering. But I think if you need one article to serve as your guide as a community of lifestyle medicine specialists, this is the article to have and to read. So I want to start first by reminding ourselves of the great father of Western medicine, Hippocrates, the Greek physician. Of course, we all know and we all remember before we entered the medical practice, we all recited the Hippocratic Oath. And we made a commitment to do no harm to our patients. But what many of us in medicine do not even know or often forget is that Hippocrates wrote so many other texts, one of which is entitled Air, Water, and Places. And I will not belabor you with the details of this quote, but as you can see in the ones that are in green, no? Hippocrates, more than thousands of years ago, was already commanding us physicians and medical students to study the seasons of the year, the hot winds and the cold, the properties of the waters. So what he was saying is that the environment is really an intrinsic part of our practice as physicians and as healers. Unfortunately, over time, medicine has become reductionist, over specialized, linear thinking, to the point that we actually forgot our responsibility, our obligation towards the environment. And so I think in this day and age of planetary health, we are now called to return to what Hippocrates was telling us many, many thousands of years ago. And of course, as lifestyle medicine specialists, as general practitioners, as family physicians, as holistic physicians, we already know this, core tenet in health, that the majority or the bulk of health is not produced inside the medical care system, not by your pill or your x-ray machine, not by the doctor nor the nurse, not by the hospital nor the clinic. Health is created outside of the medical system, in our behaviors, but more importantly, in the social and environmental determinants of health, or the social and environmental factors. And that is why we, lifestyle medicine specialists, are so important in promoting the health of our patients, but also our broader communities. And because the environment is important, we need to understand where we are right now. So a while ago, as I've said, and as you've seen in the video, we're already facing a lot of environmental crisis. And these environmental problems are anthropogenic in nature. When you say anthropogenic, it's human-induced. It's not purely natural. And what are these anthropogenic forces, these human activities that have been shaping the face of the earth for decades? Consumption patterns, demographic shifts like urbanization and migration, technological advancement. We always are looking forward to the next iPhone model or other forms of technology that undoubtedly improve our lives, but at the expense of the planet, unfortunately. As you can see in this diagram, there's so many changes happening in the environment: climate change, the loss of biodiversity, all kinds of pollution towards the air, the water, and the soil. And all of these have long-term impacts on the health of human populations, as you can see on the right. Malnutrition, infectious diseases, non-communicable diseases like heart disease, cancers, diabetes, even mental health problems. There's growing evidence that all of these environmental crises are creating new forms of mental stress. And so when I'm trying to imagine, what is the state of Mother Earth right now, just like people today wearing their masks to protect themselves from the unseen coronavirus, I think Mother Earth herself is also wearing a mask, but this time trying to protect herself from the environmental damages that we are inflicting on her through our myriad activities, the one that I mentioned a while ago. So I'm pretty sure you're all familiar with the term public health, which is about the health of people. Unfortunately, health of people, period, without necessarily thinking about the health of the planet. Now is the time to shift from a public health or a purely public health approach towards a truly planetary health approach. And when we say planetary health, we now have two patients, not just the people, but also the planet. So this is the definition of planetary health according to the 2015 report of the Lancet Rockefeller Foundation Commission. It's about the health of the human civilization and the natural systems on which it depends. So again, it takes two to tango. We need healthy people and a healthy planet in harmony. And to simplify this and to Philippinize this, to make this very understandable to the Filipino community, I always say that planetary health is ang agham ng lahat. At ang lahat ay isang acronym para sa L, lupa, A, araw, H, hangin at hayop. Idadagdag ko na rin, halaman, no? A, ako. T, tubig, tao. Lahat ay magkaugnay. So, planetary health is really about these interconnections, the living creatures, the abiotic or non-living factors, but also the human systems, the social systems that create these problems, but also that will generate the solutions to these problems. Planetary health is also described as the grand convergence, no? So I'm pretty sure we're familiar with the different disciplines, public health, tropical medicine, global health. They're all converging towards planetary health. Conservation medicine, environmental medicine, as mentioned a while ago, eco-health, preventive medicine, social medicine, the social sciences are so important because we need to understand why these problems are being generated. And I think I would add to this diagram lifestyle medicine, because part of planetary health is making sure that people live healthy lifestyles that contribute to their own health, but also to the health of the planet as well. And it's also important to remember that planetary health is, not a new concept. You go back to the indigenous wisdom and we will find out, you will discover that these indigenous populations, these cultures that have been existing for thousands of years, they have already acknowledged for many, many centuries that the health of people and the health of the planet are inextricably intertwined and in fact inseparable. So as you can see, according to Chief Seattle, one of the American Indian leaders in US history, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. So what is the state now of our planet's health? There's one framework called the Planetary Boundaries Framework. It's developed by the Stockholm Resilience Center. And basically, it says that right now there are 9 planetary boundaries, and 2 out of 9 have already been violated. They're the ones in red, as you can see. One is biosphere integrity, because over the past century, we've seen the fastest rate of extinction of creatures great and small. And we know that biodiversity is so essential for the health of people and the planet. We also are seeing that the biogeochemical flows of phosphorus and nitrogen, that's your P and N, are also hugely disrupted because of our addiction to artificial fertilizers. We pump our soil with artificial fertilizers, P and N, which destroy the natural cycles of these elements. So 2 out of 9 already in red. 2 out of 9 are in yellow, as you can see. Climate change and land system change. Climate change, of course, we emit carbon to the atmosphere, and that leads to the continuous warming of the planet. And we need to make sure that the planet does not exceed the 2 degrees Celsius global average temperature increase that is included or written in the Paris Agreement. And then the other change, land system change, it refers to the change that we afflict or inflict onto the land. So what we've done is we've changed every natural ecosystem, forests, grasslands, and turned them into subdivisions, golf courses, casinos, cities, etc. And these activities are reducing the naturalness of the planet. And so 2 out of 9 also about to be violated or breached. So this is the situation now of our planet. So, our goal is to make sure that the planet's boundaries are not exceeded. But we also have to make sure that the social foundation, the daily needs of people are met and provided. And that is why I'm also introducing to you this other framework. It's called the donut economy, and it was developed by Kate Rayworth that as you can see on the screen. When I met Kate, she was telling me, Dr. Renzo, I'm really sorry because, the framework that I developed is a donut. And I know that donuts are not healthy. They're high in sugar. But I said, you know what, Kate, this donut is the healthiest donut ever baked because this is the donut that will protect the planetary boundaries, but will also make sure that we meet the social foundation of water, food, health, education, political voice, gender equality, housing, energy access, etc. The ones that you can see in the middle. So basically, the donut economy is telling us that we need to live inside the donut, and which is what she called the safe and just space for humanity. We can't exceed the boundaries, we can't destroy the planetary boundaries, but we also cannot go below the social foundation. We need to make sure that people do enjoy all of these basic human rights. And you know what? I would recommend the Donut Economics book as a required reading to every lifestyle medicine specialist. So there's actually this study from the University of Leeds in the United Kingdom. They tried to investigate which of the countries in the world are closest to becoming like a donut. Unfortunately, as you can see, the USA and Germany, they've already achieved the social foundations. As you can see in the middle, there are no reds or close to no reds at all. But outside, you will see a lot of reds. And that means these two high-income countries have already violated a lot of the planetary boundaries. Meanwhile, if you go to our country, the Philippines, the Philippines has not violated any planetary boundary yet. So that's good news. But you can see inside that we are so we have so many shortfalls or failures in terms of achieving the social foundations. So we're doing well in terms of planet. We're not doing well in terms of people. Remember, planetary health, health of people and planet. But you can see that there is a country that is 3 hours away by flight from the Philippines that is closest to becoming like a donut. So according to this study, the country that is closest to becoming like a donut is Vietnam. As you can see, only very slight red outside and very few reds inside as well. So maybe the question is how to be you po Vietnam, right? How can we be donut economies like Vietnam? That is a challenge. I wonder what the role or what the lifestyle medicine specialists can do to help. So there's actually one city in the world that already adopted the donut economy as their post-coronavirus economic model, and that is the city of Amsterdam in the Netherlands. So we hope to see more Philippine cities and Philippine municipalities to also adopt, the donut economy. And maybe we should try to Philippinize it. I'm thinking baka dapat sapin-sapin economy because the sapin-sapin also looks like the donut with concentric circles. This is also the sad reality of the planet and people's health, that the health impacts are unfairly distributed. And that's why I always say that planetary health is at its very core a justice and equity issue. So as you can see at the top map, the countries that have been magnified or enlarged are the countries and regions in the world that emitted the greatest amount of greenhouse gases into the atmosphere. That's North America, Europe, and more recently China, because they've caught up, with the high-income countries of the West in terms of emitting carbon. As you can see at the bottom, the countries of the world that will bear the brunt of climate change and its health consequences are the poorer countries of Africa, Asia, And even the Pacific Islands are so small to be magnified in this map. In fact, maybe in 10 years' time, if we don't get our acts together, these islands will already disappear from the face of the earth because of sea level rise due to the melting of the ice caps in the poles, Arctic and Antarctic poles. So, as you can see, the emitters are different from the victims, which are the developing countries of the world, including the Philippines. So I mentioned the Philippines. We are at the heart of planetary health. I always say we are at the heart of planetary health because unfortunately, in this map, as you can see, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, the country that is reddest of them all is our beloved Philippines. And we know that climate change is going to affect the health of our communities, human populations, in many different ways. There's so many different pathways. It could be through storms, bagyo, drought, tagtuyot, no? Flooding, or even heat waves, exposure to extreme heat. And all of these will alter, the environment, will alter our social fabric, and will ultimately lead to a wide range of health impacts, which I already mentioned a while ago in an earlier slide, but I'll give you some more examples. So, of course, we know that when natural disasters or extreme weather events like typhoons and flooding do occur, it's not just agricultural systems, it's not just buildings, it's not just schools, but also healthcare systems that are being destroyed, and people's health are being imperiled. And of course, we've seen this even during the pandemic. This is quite a unique experience for the Philippines. Poor people facing a dilemma. On one hand, do I stay in the house, protect myself from COVID, but perhaps suffer from inundation because of extreme flooding, or perhaps my roof will be blown away by the strong wind? Or on the other hand, do I move to the evacuation center, protected from climate change, but facing a high risk of getting the coronavirus because, as you can see, there's no social distancing in these temporary shelters. So it's really a dilemma. It's two crises happening at the same time, COVID and climate change. What are the other impacts? So in the Philippines, we're also seeing the fastest rate of sea level rise in the world, 5 times that of the global average. So, if you're living near coastal areas, you might want to start investigating, is the drinking water of the community already high in salt? Is it already salinized? Because when seawater intrudes into the fresh water, that leads to increasing salinity. And there's growing evidence from other countries. We hope to conduct more studies in the Philippines showing that drinking water high in salt increases your risk for hypertension, miscarriage, kidney disease, specifically kidney stones, and waterborne diseases, so on and so forth. Of course, we know that the environment, climate change, is also important for the emergence of new diseases, new infectious diseases, but also the re-emergence of old and existing infectious diseases. So, for example, there were even hypotheses that Zika and Ebola, remember in the past 10 years, Zika and Ebola became outbreaks in Brazil and in West Africa, respectively. There were hypotheses that climate change has also something to do with it. And, in only time can tell if COVID-19 and other future pandemics are also related to climate change. But modeling, projections already say that there is a correlation. So what else is being affected by climate change? Mental health, for example. As you can see, climate change affects mental health, not just through the typhoons and extreme weather events, which generate, for example, post-traumatic stress disorder and other forms of mental stress, but also the slow onset effects of climate change, increasing heat, food insecurity. All of these will bring about different forms of mental health problems as well. So, fellow doctors, I invite you to visit this website from the New England Journal of Medicine. It's very interactive. You press on an organ system and it will tell you how climate change affects that organ system. So it's very important that every specialty in medicine is cognizant of how climate change is going to affect their specialty. And because lifestyle medicine encompasses, a wide range of organ systems, we need to master all these effects as well and find ways how to make sure we can prevent these diseases. And it's not just the human body that is going to be affected by climate change, even the medications that we prescribe. So there's growing research now about how increasing temperature, for example, will reduce the potency of the medicines or will change the pharmacokinetics of medicines because it's changing human physiology. So these are really new areas of research at the nexus of climate change and pharmaceuticals. So you've heard about the health impacts of climate change. And of course, I guess right now we're all very concerned about the first wave of COVID, the second wave of COVID, the third wave. I think we should also be equally, if not more concerned about not just the future waves, but future tsunamis of climate change and its related health consequences, the ones that I described a while ago. So now I'm moving to the next part of my talk. What can we do? Are we ready to build health systems that consider the climate? Are we ready to change or to reorient our practice of lifestyle medicine to consider the climate and consider the planet? So I think that in the 21st century, our health systems in the era of planetary health should, one, be universal. And of course, we know in the Philippines, universal healthcare is still, something written on paper. It still has to be implemented and realized. We all need to work together to make sure universal healthcare happens within our lifetime. We need to make sure that the care is also high value. And when we say high value care, as opposed to low value care, people become healthier, but also happier when they receive the healthcare from us. So it's safe, it's good quality, it's also affordable, it's responsive to their health needs. But also, I think in the 21st century, healthcare should be climate smart. And when we say climate smart, it should be resilient to the effects of climate change, the ones that to the effects that I described to you a while ago, disaster ready, but it should also be low carbon and green and sustainable. And later on, we'll touch a bit on that. And then finally, now because of COVID-19, we are realizing that healthcare should be pandemic resistant. Because unfortunately, because of the changes in the planet that I've described to you, the next COVID might be lurking in the forest or in a poultry farm. And so we need to make sure that our healthcare systems can detect early, respond quickly, with resources ready, and can usher a better and fast recovery. So I talk about the need for low carbon healthcare because unfortunately healthcare now is high carbon as well. So as you can see, there are three sources of carbon in healthcare systems. One is what we call scope 1 emissions that we generate inside the hospital, maybe because we have our own electricity source inside the hospital or in its backyard. We have refrigerants, we have anesthetics. So anesthetic gases are climate disruptive as well. Okay, there are certain anesthetics that are more climate disruptive than the others. Okay, scope 2, is carbon emissions taken from electricity production elsewhere. So, and I think most hospitals now or most healthcare facilities do get their electricity from another place, a power plant, for example. So that is also part of our emissions, even if the burning of the fossil fuel happened outside of our own backyard. And then finally, scope 3 is all the other sources of carbon related to our other activities, our travel, when doctors and nurses commute between the house and the hospital, that should be counted as well as part of our emissions. or the pharmaceuticals that we order, or the food, specifically the meat that we serve to our patients and to our staff alike. So there's so many sources of emissions in healthcare. And actually the estimate is that 4.4% of the global emissions are coming from the healthcare system alone. So what should we do? I mentioned already climate smart, and we need to make sure that our health systems are, embrace both sustainability and resilience. Sustainability, we don't want to be part of the pollution. We don't want to be part of the problem. And resilience is making sure we are ready to address the problems when they happen. And it's so interesting because as you can see under sustainability, look at what's written at the top. Lifestyle disease prevention is really part of sustainability. Because if we minimize the burden of disease, we also minimize healthcare utilization. And that will also minimize carbon emissions of the healthcare system. So, for example, if you're also affiliated with with a hospital or even a healthcare facility, I invite you to Google the framework of the Global Green and Healthy Hospitals of Healthcare Without Harm. You will see that there are so many different ways by which we can practice sustainability within the healthcare sector, in terms of our chemical management, waste management, the way we use our energy, water, transport, food, pharmaceuticals, the building design. So if you're planning to build your future clinic or hospital, make sure that they abide by sustainability principles. And also purchasing. We want green procurement policies to be put in place. So these are just some examples. Right now, I'm doing a multi-hospital study of energy and solar energy specifically in the Philippines. And these are just some examples of hospitals in Calamba, Laguna, the Philippine Heart Center on the right. At the bottom, the Health Centrum Hospital in Rojas City. And this is a solar-powered air conditioner from, I believe, Maria Reina Hospital in CDO. And, there are ways to calculate our carbon emissions within healthcare. So, these are just some, sample figures, no? Inpatient admission is 380 kilogram equivalent of carbon dioxide emitted to the atmosphere. And as you can see, outpatient appointments are way, way less. So, we want less patients to be hospitalized and perhaps more patients to use primary care and outpatient consults such as the ones that lifestyle medicine provides. Of course, we need to start promoting telemedicine as well. It will not only ensure that we're protected from COVID, telemedicine will also make sure that people who are hard to reach by healthcare are being reached, but also telemedicine will also reduce the carbon footprint of healthcare. So I think that is the triple, win or triple benefit of telemedicine: low COVID, low carbon, and high access to healthcare. Here you will see, okay, that primary care, which I believe lifestyle medicine is a crucial part of, has an important role to play in planetary health in terms of reducing our carbon footprint. That is what you call mitigation, and also adaptation, adapting to the effects of climate change, such as the ones that I mentioned a while ago. And this is a very recent article that I co-wrote. We introduced the concept of planetary health care, which should be part of primary care. And primary care, according to Barbara Starfield, has 7 attributes: first contact, continuity of care, comprehensive care, coordination, family orientation, cultural competency, and community orientation. And now we're adding that the care of the planet should be part of primary care practice. And so I invite you, there's actually an online course, Planetary Health for Primary Care. If you're interested, you can easily Google, and it's open until December 2021. And I think, when we talk about planetary health, we should be delivering healthcare without decimating or killing trees. No, I think that is not compatible with planetary health. And so, over the past months, we've seen these issues. Oh, let's cut trees in order to build a big mega vaccination center, or let's establish the next Philippine General Hospital, and destroy the only remaining urban forest in Quezon City. We should try to avoid these decisions because they're not compatible with planetary health. Okay. Another aspect of planetary health is food, and I remember in the video a while ago, you already it was already discussed, no, that the food system is also another source of planetary health problems. It's even called a syndemic, no, of obesity, undernutrition, and climate change. People are getting fat, or people are not receiving the nutrition that they need, and the same food system is also emitting a lot of carbon. So we need to start changing the food system if we want to address these three problems. And a while ago in the video, meat consumption was already discussed. It's emitting a lot of carbon, the second biggest emitter after energy. It was also declared by WHO as already a carcinogen, in particular red meat and processed meat. And also, we know that 75% of antibiotic misuse is not happening in human medicine, although we need to also make sure that we are dispensing antibiotics rationally. But 75% of antibiotic misuse is happening in the meat industry because we've been pumping chickens, pigs, and cattle with antibiotics as if they are vitamins. So reducing meat consumption is what I would call a quadruple win for planetary health. It will decrease cancer, it will reduce CO2 emissions, it will lower the risk for antimicrobial resistance, and it will prevent zoonosis such as COVID-19. And maybe you've heard of the planetary health diet. I'm sure our lifestyle medicine specialists are very familiar with different types of diet. And one of the diets that we should be promoting is the planetary health diet, a diet that is good for the health of both people and the planet. And as you can see, half of the plate is greens and very small part is comprised of meat. And if you translate this into a week-long diet, you will only eat meat once during an entire week. So this is a big challenge for the Filipino population because we are meat lovers. And so we need to start talking about, planetary health adobo and other dishes. There's one hospital actually in Taiwan that is, serving plant-based diet to their patients and to their staff alike. And the food is actually produced in their own backyard. So they're not anymore emitting carbon from long distance transport and from large scale farming as well. And we talk about food, we talk about reducing the carbon emissions of healthcare. There's so many things that we lifestyle medicine specialists should be advocating for. Better city design, active transport, so that our people, our patients are moving and we are polluting less. No, we're emitting less air pollutants to the atmosphere. We need to change the agricultural system, so on and so forth. So, and these are all good, not just for physical health, but also for mental health, as I already discussed a while ago. So I'm reaching the conclusion of my long talk, and I hope you learned a lot. I invite you to visit Planetary Health PH. This is our new community for planetary health, and we would love to explore collaborations with the Philippine College of Lifestyle Medicine. I think we need to start incorporating planetary health into the education, not just of lifestyle medicine specialists, but of all professionals. So I invite you to look at this framework by the Planetary Health Alliance on how we can embed planetary health in teaching and training. I invite you to look at these materials. WONCA, which is the International Society of Family Physicians, created a declaration regarding our role in terms of acting on planetary health. So clinicians do have a critical role in planetary health, and I've already talked about many of the ways you can help. And remember, I started with the Hippocratic Oath with Hippocrates, and last year we actually rewrote the Hippocratic Oath and turned it into a planetary health pledge. So later on, we'll show a short clip where you will hear, perhaps for the first time, the planetary health pledge. And I hope that the lifestyle medicine specialists and practitioners will embrace this important declaration. So we don't want to be this kind of physician giving the cough syrup to someone who comes to us with cough, with wheezing, and instead we want to address, the root causes of all these problems. A lot of them I already mentioned. We want to become like this doctor, embracing planetary health. I always say that in the 21st century, we're not just tree huggers, we're also solar panel huggers. And it will be great if our clinics and our households will adopt green energy and all these different green practices to protect the health, not just of our patients, but also the planet. We've seen during this pandemic, that this graph, the most popular graph during the pandemic, we need to flatten the curve of COVID-19. We need to ensure also that the healthcare system's capacity is increased. We add more beds, we recruit more nurses and doctors, and now we vaccinate more people. I think that this mantra should be adopted for the climate crisis and for planetary health as well. And what we need to bend or to flatten is the curve of our carbon emissions and our ecological footprint. And we need to also make sure that the Earth system's capacity is increased. No. What I mean is that the Earth system's capacity cannot be increased, unfortunately, unlike the health system's capacity. It's constant, it's non-negotiable, and it's unchangeable. We need to start changing the way politics and economics operate. We cannot anymore keep on polluting and consuming, and instead we need to shift towards a more donut economic model, the one that I discussed a while ago. I think planetary health is also about planetary humility. It's a shift from an ego-logical perspective. We, humanity, we're at the top of the pyramid. We consume, we kill, we extract, we mine, and instead we shift towards a truly ecological approach, living in harmony with creatures great and small, and with planet Earth, our common home. And I think lastly, planetary health is about becoming good ancestors. This is another great book, a very new one. And basically the message is that in 2121, that's 100 years from now, what we want is that our grandchildren, or maybe their children, will read the history books and will look back to the past. And they will say that the COVID generation of 2021, and that is us, have been good ancestors to them because we've made the right decisions, not just for our own health, but also for their health as well. Because we owe it to these children. This is a very powerful picture from Cagayan last year. Children already carried in these batyas. We're trying to protect themselves both from COVID and from the initial impacts of climate change, as you can see in this picture. We owe it to these children and to the generations that are yet to come. So together, let's advance the health of people and planet. Thank you very much. And to close this talk, I think maybe we have time to show, the clip of the Planetary Health Pledge.
I solemnly pledge to dedicate my life to the service of humanity
and to the protection of natural systems on which human health depends.
The health of people, their communities, and the planet will be my first consideration.
And I will maintain the utmost respect for human life, as well as reverence for the diversity of life on Earth.
I will practice my profession with conscience and dignity.
In accordance with good practice, take into account planetary health values and principles.
To do no harm, I will respect the autonomy and dignity of all persons in adapting an approach.
To maintaining and creating health, which focuses on prevention of harm to people and planet.
I will respect and honor the trust that is placed in me and leverage this trust
to promote knowledge, values, and behaviors that support the health of humans and the planet.
I will actively strive to understand the impact that direct, unconscious, and structural bias may have
on my patients, communities, and the planet, and for cultural self-awareness in my duty to serve.
I will advocate for equity and justice by actively addressing environmental, social, and structural determinants of health,
while protecting the natural systems that underpin a viable planet for future generations.
I will acknowledge and respect various sources of knowledge and knowing regarding individual, community, and planetary health,
such as from indigenous traditional knowledge systems, while challenging attempts at spreading disinformation that can undermine planetary health.
That I will share and expand my knowledge for the benefit of society and the planet.
I will also promote transdisciplinary inclusive action to achieve individual, community, and planetary health.
I will attend to my own health, well-being, and abilities in order to provide care and serve the community to the highest standards.
I will strive to be a role model for my patients and society by embodying planetary health principles in my life.
Acknowledging that this requires maintaining the vitality of our common home.
I will not use my knowledge to violate human rights and civil liberties, even under threat.
Recognizing that the human right to health necessitates maintaining planetary health.
I make these promises solemnly, freely, and upon my honor. By taking this pledge, I am committing to a vision of personal, community, and planetary health
that will enable the diversity of life on our planet to thrive now and in the future.
Thank you so much. It was actually a very comprehensive, yet brief intro to the planetary health. Indeed, the grand convergence. We did learn a lot, but large industries and companies are huge contributors to the carbon footprint that we produce as a collectively. But is there something that we can do as consumers that would actually have a positive impact on the environment?
Well, thank you, Dr. Jobs, for that question. Of course, we cannot discount, the power of individual consumers and families and households. In fact, if we do one thing all at the same time, that will really be creating a huge ripple effect, right? A huge impact. The problem is not everybody is doing these, green habits, for example. Perhaps they're not aware of these green habits. Perhaps people are also not empowered. They do not have, the resources that they need. We can't expect, for example, a poor family to conserve energy if they don't have even access to electricity at all. That's why a while ago I said equity is so central in this discussion. So, but education is also important, awareness raising. And I think that's where us as physicians, as general practitioners and lifestyle medicine specialists can play a leadership role in, that we use our voice to educate and raise awareness so that our patients, because patients actually listen to us, we always neglect that, the power of our own words, right, as physicians. And I think the COVID-19 pandemic has shown how important that voice is. So let's put it to good use. In the same way that we use it for COVID, let's also use it for the climate. So consumers can do a lot, no? But also I think, and because we are in a crisis mode, we need to hold to account the powerful, the big industries, the policymakers. I think at the end of the day, there has to be top down and bottom up approaches happening at the same time. If we really want to solve the planetary crisis.
Right. Thank you, Doc Renzo, for that. No, you're correct. A lot of the people are actually lost when it comes to what they can do, where they can go, who they can reach out to, especially when you talk about already top down, our lawmakers, our policymakers. In your experience, does public clamor or do the words of the citizens, do you think we can actually create change with asking the people up there to make these changes?
So if you look back at the history of our planet, right, a lot of the transformational changes have been demanded by people. People going to the streets, people even shedding their blood, or people coming together and mobilizing and shaking, the system. And we live in a very challenging times because we can't protest due to the lockdowns, but perhaps the new battlefields are one, digital. How are we using social media to really start conversations? And so I'm really glad that you're using this platform to at least educate our colleagues in the college. And I'm seeing some comments in the Facebook already that this has been very a very enlightening session, and I hope we'll continue the conversation. And again, use the social media platforms to really raise awareness, right? If we can TikTok the latest dance, we should be able to convey messages about planetary health to our communities. Also, I think the new battlefield is in the house, right? Because of course we're under lockdown. Going back to the question of Dr. Jobs a while ago, what are the things that we can already do inside the household?
Yes.
Because we can't, if we can't start within the household, what more in the community and more so in the country and more so at the global level, right? It always starts in our own spaces, in our houses, but also as physicians in our clinics, right? In our clinics. That's why a while ago I really made sure that I talk about what are the sustainability practices that we can do within our own practice, because that's something we can do tomorrow. We don't need a law, right? To tell us what to do. So the new battlefields for change, digital and domestic. O yun, parehong letter D yun. Digital, domestic.
So to tie things up, Dr. Renzo, as lifestyle medicine physicians, advocates, and as professionals, where would be the best place to start or to entice patients, people, our neighbors to actually join the movement of planetary health, the grand
convergence.
Convergence. Yes.
Well, I think lifestyle medicine physicians and the college should be part of the grand convergence, right? And you can start finding ways to incorporate planetary health into your training, into your curriculum, into your continuing medical education programs. So that's the low hanging fruit, right? Like we need to educate ourselves first if we want to actually be planetary health stewards and champions. I think lifestyle medicine is a very good entry point for working with other sectors, right? If you notice, we need to change the food sector. We need to change the transport sector. We need to change how cities are being designed. And while it might be difficult for the ultra specialists, for example, the surgeons to engage with these different sectors, I think the lifestyle physicians are actually best positioned to, have these conversations and have multi-sectoral collaborations for health creation, not just disease prevention. We always talk about preventing disease, but I think lifestyle medicine is also an advocate for health and well-being creation. And we can only create health and well-being if we have cleaner air and well-designed cities and sustainable and healthy and nutritious and affordable food options that are within walking distance, right? The very reason why people are, not able to eat nutritious food is because the healthy foods are either expensive, inaccessible physically, and maybe even not so flavorful. And so how can lifestyle physicians work with the chefs to design planetary health diet dishes that are not just nutritious and healthy for the planet, but also tasty for the tongue and good for the heart and the Filipino spirit. So, there's so many things that we can do and to work together just by thinking of food alone, which I think is so central in promoting healthy lifestyles.
Thank you. I actually agree, Doc, kasi especially in our Filipino culture, food is very central to a lot of our social gatherings. So that gives you the opportunity to change the way people see food, but also we take advantage of the fact that there are a lot of people congregated, let's say at a birthday party, and you introduce to them how good healthy food can actually be. So, that of course spreads out exponentially when they get to share this with the people they encounter, on other days in their life. So thank you so much for accommodating our questions so far. There will be questions though from our viewers, so we will get back to that. But before we proceed to hashtag Ask Doc, what can our viewers do to stay updated with our future events and webinars, Doc Javs?
So we would like to invite everyone to next month's webinar live on Facebook. Stay tuned for announcements on PCLM's Facebook page.
Right. We would also like to invite you all to our upcoming annual conference this September 2021. Please watch this video, after which we will go back to our viewers' questions. See you soon, Doc Renzo.
The Philippine College of Lifestyle Medicine recognizes the important role lifestyle medicine has to play to address both the non-communicable diseases and the pandemic affront. It is an evidence-based, interdisciplinary approach that promotes prevention, treatment, and even reversal of some chronic conditions. Join pioneering clinicians, researchers, health executives, educators, and public health professionals that stimulates the innovative, full-range implementation of lifestyle medicine domains with an interdisciplinary focus translated to the patient's health outcome. This year's theme is Lifestyle Medicine for COVID-19 and NCD Care, a wake-up call. Be inspired by our special guest speakers who are instrumental in the innovative and exponential growth of lifestyle medicine in their specific fields. Expand your knowledge and explore best practices in prevention and healthcare through our lifestyle medicine. Join us on September 26th to 28th, 2021. Visit our website for info.
Hello, and welcome back, everyone. So glad to see you all back with us. So let's jump straight to our viewers' question. Doc Ann? Doc Ann, for the first question to Dr. Renzo.
Okay. Um, so, while still living through this pandemic, what can we do when it comes to the PPEs that we wear, such as masks and face shields? I think a lot of our viewers can relate to this because we all can say talaga na we are creating so much waste.
Right. Sige. Well, thank you for that question, Holly, Dabon. I think, so one, I think it's important to remember that we should have put in place sustainable, environmentally friendly healthcare systems even before the pandemic started, right? So I think that's an important first point, right? That ideally all of these should have been put in place before so that it would have not been a problem, right? Of course, this is what happened already. We entered the pandemic, everyone is panicking, and environmental considerations were put on the at the back seat, right? Um, and during the first few months, I personally thought, okay, maybe sige, let's focus first on containing the virus, and then after that, we have to make sure that the succeeding months and years of pandemic response should be environmentally sustainable. We're already, I think it's already close to 1.5 years since the beginning of the pandemic. By now, we should have already mastered how to do this in a planetary health respectful way. Unfortunately, that's not yet what we're seeing. We're still using a lot of these PPEs and masks and even face shields. Although, as we know, the face shield is now being reevaluated as a policy in the country. But all of these are still being used, and we have not really put in place, good mechanisms on how to either dispose them of properly or to even minimize their use. Okay, so these are the core challenges now, and yes, we need to start in our hospitals, in our health facilities, to put in place better disposal systems, but we also want to make sure that we find ways to reduce the use, and that means we need to make sure that uh, we reduce the need for healthcare, and that means we need to contain the virus. So as long as the virus is not contained, unfortunately, we will be using a lot of these, right? Number two, we need to be very serious with our vaccination campaign, because again, that will also help end this pandemic faster. So we will also end the use of so many PPEs earlier, right? So you get the logic, right? It's all about making sure we win this pandemic. And I think there are also other reusable options. So for example, I'm aware that at least one hospital in Iloilo, the St. Paul's Hospital in Iloilo, has already embraced reusable PPEs, and they were able to also ensure that there is very low, hospital infection rate, but at the same time, low or reduced use of disposables. So I think the quick answer is there's so many ways to address this issue. It's never too late. Unfortunately, the pandemic is not ending tomorrow, and we need to make sure that from now until the end of the pandemic, we abide by green sustainability principles in the practice of healthcare.
Thank you for that. Doc Chavs, I believe you have a question from...
Yes, in the interest of time, I think this would be the last question for Dr. Renzo. So this is actually connected with the first question. Would you have any advice for the struggle between, of course, our sari-sari store, the use of sachet use, and the portion, because of the portion of our population who cannot afford to buy in bulk?
Very good question. And, I just saw a Rappler article saying that, this bill that seeks, this law, or proposed bill that seeks to ban single-use plastics, including sachets, are actually anti-poor, right? Anti-poor policy. And that's what I was saying a while ago. When we talk about these planetary health problems, we need to ensure there's equity and justice in the policies and solutions.
Yes.
We can't just say, oh, let's have a green lifestyle and it only caters to the elite. We need to make sure we create green policies and solutions that are reachable to the among the poor and the marginalized. So this problem is not as easy as it's not as easy as being the solution is not as easy as let's ban the sachets, right? We need to really think through how to find a way that will protect the planet but also protect the people. And that's why planetary health is, if you remember, is about balancing the two.
Yes.
For example, I have a friend actually who works in Indonesia, and they already started this innovation where they put up, like a vending machine kind of technology for refilling your shampoo and all these, your lotion, and they're usually located in the slum areas. So that's not anti-poor because it makes these
still
everyday commodities accessible. Bring your own bottle and refill it with shampoo and conditioner and soap at a very low price. Even our liquid detergents or for washing plates, for example. But at the same time, it addresses the environmental problem. So there's so many solutions. I think we need to also just think out of the box.
Yes.
But also we need to make sure we think about the people while we also think about the planet.
Definitely. So I think we have our work cut out for us. We have to really knock on the doors of these big corporations and, of course, our policymakers so that we can all come up with a solution to, a lot of the things.
Yeah, if I just may just add, because you mentioned the big companies, right?
Yes, Bob.
Because I think for them, and I saw in Facebook, Ryan Salvanera said tingi culture. For them, for the big companies, tingi culture is lucrative, right? It makes money. But remember, in a donut economy, our goal is not purely profit. Our goal is, do we actually protect the planet and the people? So if you notice, the economic model will need to change. Otherwise, the sachet or the tingi culture will remain because that is what makes the investors happy, right?
Yeah.
So
thank you for pointing that out, though.
Yeah, we're going. I think planetary health is really about challenging the status quo.
Yes.
And it requires a very high degree of courage. And so, lifestyle medicine doctors, be courageous.
Thank you so much for that. And thank you to everyone who sent in their questions. We're really sorry that we were not able to go through all of them. But if you do have further questions or if your questions weren't answered, you may send them to our guests directly, or you may also send them to the Philippine College of Lifestyle Medicine Facebook page, and we will try to get back to you. All right, so that's all for our hashtag Ask Doc segment. And Doc Renzo Ginto, thank you again so much for your time. But now let's go on to our Mythbusters.
Okay, so welcome back. Welcome to our next segment, the Mythbusters. Now, I know a lot of you know how this works. For those who have joined us, we invite our viewers to answer myth or fact on the comment section after each question is read. The first one who types the correct answer correctly, of course, for each question will win a prize. It's super fun, plus great prizes await the lucky winners. So for our first Mythbuster, uh, the increasing global demand for meat and meat-based products has little or no contribution to climate change. Is this a myth or a fact? Comment down below. Okay. Okay, I see some answers. So this is a myth. So the Union of Concerned Scientists sees meat eating as one of the biggest environmental hazards that the planet is facing. The increasing demand for meat and meat products not only takes an enormous toll on the environmental resources, but also produces devastating effects on the environment. For example, to produce a pound of meat, we need 25,000 gallons of water. However, for a pound of wheat, we only need 25 gallons. So another example would be how we produce a 99.48 kilograms of greenhouse gas emissions for every kilogram of beef. So take a moment to let that sink in. Anne?
Right. So that's a lot of greenhouse gas emissions for just a kilogram of beef. That fact actually blew me away because I didn't think that the repercussions were actually that much. But let's move on to our second mythbuster. It is said that air pollution is associated with the development of depression, anxiety, and suicide risk. It is said that air pollution is associated with the development of depression, anxiety, and suicide risk. So, is this a fact or a myth? Comment down below. All right, so I can see some answers. I hope everyone gets to chime in. The answer is actually fact. So that statement is some say air pollution is associated with the development of depression, anxiety, and suicide risk. This is true. Air pollutants, especially particulate matter, induce inflammation and oxidative stress in the brain that can lead to exacerbation of depression and anxiety. But you may ask, what is particulate matter? A good example would be when automobile exhaust reacts with the water vapor in the air, and the product of this reaction produces particulate matter, and this product is what is associated with declines in mental health. So air pollutants can also cause serious neurocognitive effects, ranging from changes in behavior to actual neurodegenerative disorders, which of course we know ultimately can have devastating effects on mental health. So I hope you got a good information about that question. How about you, Doc Jabs? I think you have one more.
Yes, no, that is something new that I learned. Okay, moving on for our third and last mythbuster. Climate change may alter human physical activity patterns. This is a myth or a fact? Comment down below. So this is a fact. So using data on the reported participation in a recreational physical activity from over 1.9 million US survey respondents between 2002 and 2012, coupled with daily meteorological data, we saw that both cold and acutely hot temperature as well as precipitation days reduces physical activity. So like in the USA, activity may increase most during the winter in the northern states and declines most during the summer in southern states. So we will be announcing the winners later.
Right. Thank you to everyone who participated in Myth or Fact. Stay tuned, please, to find out if you are one of our lucky winners. We would also like to again thank our guest, Dr. Ginto. Thank you for spending your evening and expertise with us. It was truly a uh, eye-opening and mind-expanding lecture. I wish we could share this more with other people, but I'm sure we can because they can catch again the Wellness Avenue episode on Philippine College of Lifestyle Medicine's webpage. Sorry, Facebook page.
So
Um,
again,
yes.
thank you very much, Dr. Renzo, for this very informative night. And to all our viewers, if you have any questions, inquiries, or clarifications, you can reach Dr. Ginto through his social media accounts in Twitter at Renzo Ginto and LinkedIn at Renzo Ginto. Nothing fancy though, just Renzo Ginto.
All right.
Just like
Would you have any parting words, Renzo, for our viewers?
Well, again, thank you very much to the college for this wonderful opportunity. I hope this is not the last that we will be working together for the health of people and the planet. And stop spreading the COVID, but start spreading the positive virus of planetary health. That is my, clarion call to all of you. Thanks again, and stay safe and be
Thank
vaccinated.
you. Yes, thank you so much, Doc. Um, uh, Doc Chavs, how about before also we move on, we say hello to some of our viewers?
Of course, Doc, we have our mainstay viewers from, of course, Iloilo, first from us, Zamboanga, Mindanao, and then I think I would like to read some feedbacks from our viewers. According to Dr. Arlene, this is an eye-opener. Thank you for this very timely and important topic. Uh, Dr. Ethel, she says it's a wow, great lecture, Dr. Renzo. We learned a lot. And how about you, Doc?
Okay, I would like to say hi actually to my co-doctors and some of my staff from the Philippine Red Cross Isolation Facility. So hi to Sir Michael, Doc Vian, Doc Adrian. Thank you. They even joined the games actually. Also hi to Kuya Ryan Salvanera. Doc Renzo mentioned him earlier when it came to the tingi culture. He's actually a very good friend of mine. Thank you for joining us tonight. Also, hello to Doc Phoebe Letaba. I saw your comment. I'm so happy you're with us tonight. All right. So, what do you say, Doc Javs? How about we announce the winners of our Mythbusters now?
Before that, Doc, we'll be with our. I will be thanking our partners.
Yes, let's thank our wonderful partners. We would like to thank the Remnant Institute, Center for Lifestyle Medicine and Education, Culinary Medicine, Culinary MD, the Four Leaf Lifestyle Medical Group, Plated Prescriptions. How about you, Doc Jabs?
We would also like to thank our sponsor tonight,
Foligo, and ARB
ARB
Salad
Salad
Master.
Master.
Yes, there you go. So, um, last but not the least, definitely, we would like to say a huge thank you to our events committee helping us behind the scenes. We have our talk show and creative director, Dr. April Don Lucero, our floor manager, Dr. Shiril Halad, our technical director, Dr. Carissa Los Santas, and helping us on Facebook is Dr. Phoebe Letaba. So a big thank you to all our supportive PCLM officers, and of course to you, my co-host, my dear Doc Jabs Esturco. Thank you so much.
It's mahirap maging artista. So at
Ito na,
this
Doc.
juncture, we would like to announce our winners of the Meet or Fact. We'd like to congratulate the following winners. For Meatbuster number one, we have Rachel Famero Fiolog. Meatbuster number two is Dr. Anastasio, Dr. Thea, Claire Castillo. And the third winner is wow, lucky girl. Rachel Camero, Fialog. So, anong kailangan do kung nanalo sila?
Okay, so congratulations to our winners. But we do need a few things from you. Please message us on our Facebook page on the Philippine College of Lifestyle Medicine. Please send us your following details. We need your name, your address, your email address, and your contact number. So we need this information just to be able to send to you your prizes. Okay, if you have any questions or concerns, you may contact me on Facebook. I also have Facebook. I have my Instagram too, and I have Twitter. Or you can email me directly, and I will try to accommodate you as much as I can.
And you can contact me on my Facebook page, Zamora Lifestyle Medicine Clinic by Dr. Abdul Jabbar Esturco at Zamlife Med Clinic.
Okay. So also send us some love. Most definitely give a like, a share, and a subscribe to the YouTube channel of the Philippine College of Lifestyle Medicine. Follow us on Facebook for updates and live streams. If you want to stay updated on the next episodes of the Wellness Avenue, do like our page. Also, visit our website. Membership is open for physicians and allied health professionals. We also have varied courses available on our website if you are interested in lifestyle medicine. You may leave us a message on Facebook as well if you are interested to become a certified lifestyle medicine physician or professional.
Yes, thank you again to everyone who spent time with us tonight. We have extended time actually, so we look forward to spending more informative and fun moments with you all in the future.
Yes, we hope you guys learned and had as much fun as we did. And see you all in the next Wellness Avenue. Stay safe, stay healthy, and good luck on your journey towards a healthier and happier life, the lifestyle medicine way. Good night, everyone.
Our gut is the home of trillions of living microorganisms. In order to live, multiply, and perform their functions, they need to be fed sufficiently, or else they will look for other sources of food within our body, which will eventually make us sick. Fruits and vegetables contain prebiotics, such as fructooligosaccharides, the right food for our gut bacteria. However, proper amount may not be acquired through natural food only. Hence, supplementation is needed too. Feed your gut with Folago. Thank you.